Now we'll proceed to the next aspect of the obstetrics and gynecology as regard reproductive tract infections. So look at what is known as the pelvic adhesions. Pelvic adhesions. So when they say adhesions is just simply can you see these whitish stuffs trying to connect different organs? Those are the adhesions. So if we say pelvic adhesions, we're saying that you can have abdominal adhesions, okay? Abdominal adhesions, they occur in the abdomen, way up in the gastrointestinal tract. So if you are talking about pelvic adhesions, it could be in the lower abdomen, down to the pelvis. You're having those whitish stuffs trying to connect, okay, right into your reproductive tract, trying to connect different organs, So they are just bands of scar tissues that form between pelvic organs if you are talking about pelvic adhesions. Of course, when they form there, they are not supposed to be there, so they can cause pain. They cause a lot of inflammation that sometimes when a woman wants to conceive, there's issues. Then they cause a decline in the function of those organs, right? So there are fibrous bands they develop between organs in the pelvic cavity. So they can develop between organs like the uterus, just like what this is a typical picture. Uterus, the ovaries, the fallopian tubes, the bladder. So they are sticking, they are connecting them. So causes, sometimes it's a side effect of some surgeries you had earlier on, okay? Endometriosis, okay? Pelvic inflammatory disease. Then probably from infections like chlamydia, gonorrhea, and the rest of them. So sometimes they did surgery for appendicitis, surgery for bowel surgery, and all of that, So symptoms. Such a patient with pelvic adhesions will have a lot of pain. If it's a woman, if she tries to conceive with this, it's usually hard, okay? Adhesions can even form and block the fallopian tube. Egg is not coming down, sperm is not going up. Do you understand? Infertility, pain during intercourse, bowel and bladder dysfunction, but some people have it and they are symptomatic. That's why they advise you to always go to the hospital for checkups. Now if you want to pick it up, physical examination, imaging, laparoscopy. Then treatment, laparoscopic adhesiolysis rather, okay? So you kind of like cut it out, surgically remove the adhesions. Hormonal therapies, pain management. Then if the woman is not conceived very well, you can actually do in vitro fertilization, okay, where you culture the embryo outside before just putting it directly into the uterus.